Okay, hello, we're back. In this video lecture, we're going to talk more about coding and classification systems, particularly starting off with CPT and HCPCS. So let's have a look. Okay, HCPCS, which stands for the Healthcare Common Procedure Coding System, is split into a few levels. It's actually two different coding systems. CPT, which is what most of us think of, right? Procedure codes, right? And then we have level two, which is the professional services, products, supplies, and what have you. Level two is published by CMS, and this is updated quarterly. And like ICD-10-CM and PCS, you can get it in print, online, or in software applications. And again, these codes typically are assigned by a coding professional, a CPC, RHIT, CCS, CCSP, what have you. And it's used for reimbursement of ambulatory, in other words, medical office care. Also has some modifiers, right? And a good example is the modifier 25 exam. I come in for an office visit. They assign an evaluation and management code depending on how complex my care is. And then they do a procedure, right? They give me an immunization or what have you. They use the modifier 25 to show that it's a separately identifiable procedure. RX norm is something that is basically standard nomenclature for clinical drugs. There's no coding book, there's no assignment done. These are embedded in the software applications, right? And they're weekly and fully updated monthly updates. These are new medications that are coming out really all the time. And this is used to communicate drug-related information. It's a standard for certified EHR systems. And the big concept to bear in mind is that each medication has a unique identifier, a unique numeric or alphanumeric string that identifies that drug and only that drug. And it includes the ingredient, the strength, and the dose form. We also have health data and information sets, right? And we're going to get into these. And these are basically list of recommended data elements for uniform definitions. So we use these in registries, we use these in clinical decision support. And one thing that is really, really important that we're going to introduce you to in the next couple of slides is the clinical quality measures that these health data and information sets involve. What is OASIS, the Outcome and Assessment Information System? And this is collected from payers on Medicare beneficiaries that are receiving care in a Medicare certified home health agency. And basically, it's essentially a scorecard showing how the home health agency is doing on these agreed upon outcome measures. Another one that often students get involved with as one of their first jobs is HEDIS, which stands for Healthcare Effectiveness Data and Information Set. HEDIS is sponsored by the National Committee for Quality Assurance, which we know as NCQA. It's designed to collect not just clinical data, but administrative, claim, and other data from electronic health systems. And they allow you to use, if your electronic health record system is robust enough, electronic measures or to provide them with medical record reviews and send copies to them. How this data is used, this is used by healthcare purchasers and consumers to compare performance. It also has a tie-in to how much health plans can charge during open enrollment. It's tied to their HEDIS scores. The Uniform Hospital Discharge Data Set, which you're familiar with if you've taken ICD-10-CM, is the data that's collected by acute care and short-stay hospitals. And it has the core data elements that we all know and love, especially the principal diagnosis. In other words, the condition established after study that caused the patient to be admitted, right? That is part of this uniform hospital discharge data set. We also have the United States core data for interoperability, and basically these are standardized health data classes and data elements that were adopted so different EHR systems can exchange information with each other, right? Kind of enhances the health information exchanges. Earlier, I think we mentioned that with over 500 different EHR vendors here in the United States, many of them have different field lengths for certain things. And these types of USCDI allow the information to flow back and forth with these systems. And of course, we have the database of clinical terminologies, classification, and code systems. So this is a centralized location for all these types of things, involves the meta thesaurus, the semantic network, and it's basically, you can look at it as some of these kind of like a super thesaurus or dictionary for anything that's related to electronic health record systems. A lot of interest in this, especially with the lexicon, now that people are using AI systems to do different things with health information. And that's all I have for you. Come back and we'll talk more about these different systems, and we'll get into the role of auditing for health information management professionals. Bye now.